This video is intended for training purposes. Healthcare facilities should develop procedures based on available equipment and staff. It is imperative that all protocols be tested and practiced while wearing personal protective equipment to ensure applicability and team readiness. Central venous catheter, insertion and placement of a central line for a patient infected with Ebola or other special pathogen. In this video, we identify special considerations for inserting a central venous catheter, also known as a central line, in a patient infected with Ebola or other special pathogen. In general, the technique for central line insertion will mirror your institution's standard central line insertion procedure. In this video, we will highlight additional considerations to be taken into account when performing a central line insertion in a special pathogen isolation area. Before beginning the procedure, ensure all necessary equipment and supplies are gathered and properly set up within reach to allow for easy access as needed. Placement of a central line in a patient infected with Ebola or other special pathogen should be considered early in the plan of care. Early placement is recommended to help facilitate phlebotomy and minimize the risk of exposure from needle stick injuries. Additionally, the early placement of a central line will help expedite the administration of infusions in those patients that may become critically ill. Depending on the disease process and status of the patient, consideration should also be given to obtaining coagulation studies prior to central line insertion. Throughout the central line insertion process, healthcare workers will be wearing personal protective equipment that may be uncomfortable and restrictive. This may result in decreased dexterity and tactile sensation. Wearing a PAP or hood or face shield, for instance, will reduce visual acuity. Wearing an additional layer or layers of gloves will affect hand dexterity and tactile sensation. This visual distortion and loss of tactile sensation can make routine movements and tasks challenging. For these reasons, healthcare workers are urged to work cautiously and be mindful of their limitations. Communicating with team members during the central line procedure will be challenging. Wearing PPE can be noisy and muffle sounds, making communication difficult. Healthcare workers will need to speak in a loud, clear tone and be prepared to ask coworkers to repeat themselves to verify understanding. Necessary equipment for a central line insertion includes a standard central line insertion kit. If the insertion kit contains a straight needle, we recommend exchanging the straight needle for a curved needle and needle driver, as a curved needle is less likely to cause a needle stick injury. Additional central line insertion equipment includes alcohol-based hand rub, EPA-approved disinfectant wipes, absorbent pads, and an ultrasound machine. For safety reasons, it is recommended that a central line insertion procedure in a special pathogen isolation area require a minimum of 3 care team members, 1 to perform the procedure, 1 to assist at the bedside, and the 3rd to monitor the patient. This 3rd care team member will also play an important role in monitoring the procedure for breaks in sterile technique or exposure to bodily fluids. Place trash and sharps containers close to the area to minimize the need for movement once the procedure has started. Place the ultrasound within your field of view, noting the limited peripheral vision you will have while wearing the PAPR. Place an absorbent pad underneath the patient to absorb any fluid seepage and to facilitate cleanup. As with any procedure, ensure institutional protocols are followed at all times. For example, conduct a timeout with all care team members just prior to the procedure to validate the approach and process, and ensure all required equipment and supplies are prepared. Use of the left internal jugular vein for central line placement is preferable given the higher rate of new pneumothoraces associated with subclavian lines. It is also easier to apply pressure to the internal jugular site if bleeding occurs. The femoral vein should be avoided due to the concern for contamination. The right internal jugular is ideally reserved for the placement of hemodialysis catheters if necessary. Because central line placement is an invasive procedure, sterile PPE should be worn over the top of the routine biocontainment PPE for the protection of the healthcare worker. If the institutional protocol includes wearing a disposable apron or gown over a coverall, it is reasonable to consider replacing the outer garment and the external layer of gloves with new, sterile ones. Donning these new sterile items should take place at the bedside. As with any central line insertion, sterile technique should be observed throughout the procedure. Place a sterile drape over the patient, making sure to leave the procedure site exposed. As you prepare supplies for the central line procedure, be mindful of all sharps and their placement on the sterile field. When preparing for the use of ultrasound, allow the second healthcare worker to assist. The third healthcare worker, in addition to monitoring the patient, is also available to assist should the need arise. Once venous return has been established, be mindful of gross contamination when removing the guide wire, as blood exiting the finder needle may contaminate gloves or other parts of the PPE. Handle the guide wire with care to prevent it from uncoiling and splashing blood. Suturing the central line in place carries a higher risk of exposure in comparison to the other steps in this procedure. To help minimize the risk of a needle stick injury, it is recommended to use a curved needle and needle driver. Alternatively, if your institution's policy permits the use of a non-suture securement device, it can be used to avoid the risk of a potential needle stick injury. Additionally, always be mindful of the location of sharps in the work area throughout the central line insertion procedure. An assessment for pneumothoraces or line position can be performed using a portable chest X-ray. If an experienced operator is available, ultrasound can also be used for assessment in the special pathogen isolation area. After the procedure is complete, ensure all sharps are accounted for and safely disposed of. Place all instruments in a location where they will not contaminate other equipment or surfaces. Clean and disinfect the area, and remove and dispose of all waste per institutional protocol. Additional resources are available at the NETEC and CDC websites. If you have any questions, please contact NETEC directly at info@netec.org. Thank you.